is important to take the steps and draw a line in the sand so that students know that during the course they will not have to sit there and listen to other people's silly or inappropriate questions during the course. If they ask a question that is outside your area of expertise, this is an opportunity to say, "Barry, remember we had a discussion this morning. This is more of an advanced question. We have to move on, but my email is listed on the whiteboard if you wanted an answer tomorrow." This way, you stop those questions before they're even asked. If you draw a line in the sand right from the beginning and tell them what's expected, 99 people out of 100 understand. Not only that, if you have a class of a few from the same workplace and everybody knows that Joe Blogg is a difficult individual and disruptive, it immediately makes them feel at ease because they know that he is a troublemaker and he is not going to get any clean air. Your student may or may not be an issue. If not, there is no need to think about the following. There are many methods to handle this issue. If this one particular student was interrupting your class, and if the remaining students were going to them as the source of information, then you'd start talking about chest pain. You would simply state, "Joan, you are a very experienced paramedic in America with 25 years of experience." This would be a simple question for you. What are the 3 layers of the heart? I'm guessing that this person would not have that knowledge, and therefore it gives you the opportunity to demonstrate to the class that this person is not necessarily as experienced or knowledgeable as they say they are. If they know, then simply state, "That's correct," and move on. If they don't know, or it gets it wrong, I'd simply say, "Sorry, I thought a man or woman of your experience would have known this." Then simply state they are endocardium, myocardium, and epicardium. And they continue with the lecture about chest pain. Again, if they did not get the hint and continue to be an issue, simply talk about head injuries. What are the 3 layers of the brain? If they know, then simply state, "That's correct," and move on. If they don't know or get it wrong, you could simply state in a much more longer drawn out manner, "Sorry, I thought a man or woman of your experience, having worked as a USA paramedic firefighter, would have known." Then simply state they are geomatter, arachnoid matter, and peer matter. Almost immediately you gain acceptance of the class as you are the technical expert. In your initial introduction, especially if someone in the class sounds like they have some experience, I would state when you're completing your CPR practical, please do not assist other students with advice about how they do their CPR. This can be confusing for the student who is perceived by you as needing help. Throughout your class, try to refrain from using slang, shortened terms, acronyms, or medical terms without explaining what they actually are. Whilst you may know certain terms as second nature, a lot of students will not understand a term and won't question what that means. If you are using a term that is not common for everyday life, be sure to record it on the board and explain for all students. Breaks and lunch. As a trainer, you have to be very mindful of your health and safety at a course. Prior to morning tea, you should allocate a task. I would presume it would be probably CPR, and the students are required to complete a set of CPR or other tasks, whilst you get your own coffee, tea, or water. If you allow students to get their coffee and tea first, you will find that the next subject is due to start and you haven't gotten any refreshments. You must get yours first, and this also allows for toilet breaks and telephone calls to occur during break. You may like to consider ordering morning tea, lunch, or afternoon tea to have in the premises. This gives students a chance to talk to other students, ask you questions, approach you about issues, for example, learning difficulties, or allow you to build a rapport with the students. One-day first aid course with pre-course study. In a one-day first aid course, the greatest mistake for trainers is the overuse of PowerPoint presentations. PowerPoint presentations stop the opportunity for students to practice and see how they can complete tasks, learn first aid and become confident. You should only use PowerPoint presentations, say 5 to 8 slides, on the assessment items. For example, asthma, prior to the practical training. That's smart. But going through a 200-slide presentation for the course, well, that's just silly and provides a very poor outcome for students. Through feedback from trainers, we have found that having appropriate pictures throughout the slides gain more attention from students. But having relevant, current and real-life stories allows students to relate better. Whilst you are not going to have your own story for every section, you will learn stories from classes you teach, courses you attend, trainers that you meet, and even from newspaper or television news. All of the knowledge required of the training packages are contained within the pre-course study, so there is very little need to cover topics in much more detail, or that aren't covered in the workbook unless you have a customizing for a course. For example, a childcare setting would require little more information about childcare incidents. Usually, for a public course, there is no need to go over knowledge questions in great detail. So how do we recommend you start your first aid course? With the knowledge that you have received after the introductions are completed and they have completed all the pre-course information, you would start your course by quickly visiting the pre-course questions. This way, you can indicate if any of the students had any difficulties understanding or answering the questions. If you have students with some learning or English difficulties, I'd probably spend no more than 10 minutes just going over the questions in the pre-course study, just to ensure their compliance with the answers. For example, there is a question about the Australian Resuscitation Council. You could just indicate that they are responsible for coordinating first aid procedures in Australia. Although first aid organisations are required to follow their policy advice, then you really shouldn't visit this knowledge question again. So you would just lead the students instead of asking them questions about the pre-course questions. There are session plans and assessor guides for each of these courses. These must be studied before you deliver a course to ensure that you are covering all that is required in a suggested manner. Your course should consist of virtually using the enrolment assessor criteria for your course. For example, if we use CPR as a topic, you would talk about CPR and maybe a small PowerPoint presentation, 8 to 10 slides if you feel necessary. You would then demonstrate CPR or show a video, and then students would practice CPR numerous times during the day, and at some stage, probably later in the day, you would look at their CPR as an assessment, and you may not necessarily tell the student that you are assessing them. The students would need to be demonstrating CPR as per the training package requirements. At the pre-enrolment interview or student information that is given to the client or student, if a student indicates they may have trouble in completing adult CPR on the floor, you can allow them to practice the CPR on a table to limit the amount of times they would have to kneel down. But for their final assessment to be found competent as per the training package, they would have to do the last assessment of 2 minutes of CPR on the floor. It is our advice, where there could be a dispute to your competency finding, that the skill is videoed and supplied to Alan's training in order to justify your decision. It is vital that entry into this course depends on the practical requirement of the course. If you come across students who need extra help, to try and use them in your demonstrations. Instead of making the person applying the first aid, use them as the person you are applying the aid to, but get them to help you. This way, they are experiencing the situation again, get to watch you apply the treatment correctly again, and don't lose confidence being in front of the class. You can engage your students to talk about their own experiences. For example, you could ask if anyone has a puffer. If so, there is an asthmatic in the group, and it is a good opportunity to get that asthmatic to talk about their condition and how they manage it. This method allows the students to deliver the training by way of social interaction, and you are merely facilitating the discussion. This method means that you are not necessarily doing the training, you're not actually telling them anything, but you have a variety of students that talk about their conditions at that stage. After the engaging discussion, this gives you the opportunity to round out the understanding if necessary. You could talk about the treatment and then go on to the practical application of the spacer and the puffer, and you would have the students practice that skill for a period of time. Whilst they're fulfilling the skill, you may assess them at that time as being competent for that skill. Later on in the day, when you're talking about turning an unconscious casualty onto their side, you could have the unconscious person become conscious, then develop an asthma attack requiring casualty assessment to be completed and the application of asthma treatment. If your student is sitting in a chair for longer than 5 minutes, we would suggest that you probably need to re-evaluate your classes. In our opinion, the most successful classes are those classes where students are continually completing first aid tasks and interaction with each other, thus learning and developing their confidence and developing skills in applying first aid. If you are using a lot of PowerPoint slides, then they are not listening to you and they are not practicing their skills, and they will not be confident and you will not have a successful course. In our experience talking to students, the most successful classes are those classes that the students were having fun. They laughed and they are experiencing the skills and required in a progressive manner throughout the day. Make the course practical. The main purpose of the practical training day is not to deliver training that was already covered in the pre-course study, but to deliver practical training and demonstrate to the students how to complete the practical components of the course and assess them in these practical tasks. A lot of trainers feel that they have to cover every single component of the first aid workbook again, and therefore we find that a number of students complain that they are covering topics that they have already learnt about in their workbooks. However, at the start of a class, you could ask the students if you want any particular topics covered throughout the course. This way, you are keeping them engaged by including relevant topics to them. As well as this, if you were to be teaching a course for a particular client, you'd want to customize sections accordingly. For example, if you are teaching a childcare, they may want further information on febrile convulsions rather than an aged care facility where you'd want to focus more on strokes. We suggest that you follow the session plans that we've created for each course that are listed on the website for you to download, print and take to your class. These session plans show what needs to be covered in the class and leaves out all those extra topics that were covered in the pre-course workbook and not required to be covered again. The day is meant to be fun and practical. Students should be constantly off their chairs and demonstrating these practical skills. Whilst you would of course get the students to complete the obvious practicals, for example asthma puffer, EpiPen, CPR, defib, etc., you can have them all doing practicals all day. We suggest that throughout the day you continually stop the class, get the students in groups of 2 and 3, make one of the students unconscious, and make the unconscious person decide what is wrong with them. Therefore, the second student is required to roll them onto their side. The casualty regains consciousness. The first aider has to assess the student, figure out what is wrong with them from their symptoms and treat appropriately. The victim decides on the condition. The first aider then has to perform the treatment. For example, broken arm, anaphylaxis, chest injury, etc. This way, the students have fun making their own scenarios and working out the correct treatments. PowerPoint presentations. PowerPoint presentations are only beneficial in training for complicated facts. For example, in confined space courses, knowing the oxygen concentration that may cause you harm. If you deliver a blended delivery first aid course, there is no place for PowerPoint presentation slides other than emphasising some particular issues. For example, anaphylaxis, asthma, and unconscious casualties. The whole course should have the students continually practicing skills as previously mentioned, and this would be engaging for the students as well as reinforcing their understanding of first aid treatments. Thank you for watching this video on delivering a first aid course. If you have any questions or suggestions regarding this video, please contact us at Allen's Training so we can help you further.